I'm Amy Robach, a mother, journalist, an early breast cancer survivor, and your correspondent. Welcome to Voices of More, a candid space for real talk about living with breast cancer where nothing is left off the table. In this episode, we'll discuss the complex emotions that often accompany this diagnosis. Joining us today is Lena, a working mom and California native who lives with her 3 kids and loving husband. Lena, welcome. Thank you for joining us and being willing to be so open with us today.
Thank you so much.
There is so much to talk about in terms of your breast cancer journey, but I'd like to begin with understanding who you are outside of breast cancer. How would you describe Lena?
I am a mom of a 10, 9, and 5-year-old, and being a parent has really taught me how I lead, how I love, and how I show up. Like even when I'm spread thin, I am a wife to a husband that puts up with the chaos I bring in, and he keeps me calm. And I ironically work in the healthcare industry on the sales side. And a little bit about me at my core, I consider myself resilient. I really love people who are witty and give a little sass and sarcasm and just hold space for when conversations get deeper.
I love that. And you know, that's who you are outside of what you've been experiencing over the past couple of years. But can you take me back to that moment when you recognized something was off?
I went to go do a mammogram and they said, hey, you have dense breast and we're going to need to do another mammogram. It was December 15th, 2023 when I got diagnosed. I just remember falling to my knees and just starting to cry, and I wasn't an emotional person at all, right? I always kind of kept it all in.
What was the hardest thing to come to terms with? Just the fact that you had cancer, or was it more than that?
I didn't think I was invincible, but I was shocked. I did everything right. I ate right, I exercised. You know, I lived a certain life that I didn't realize was going to help me with starting to put up the fight.
Emotionally or physically?
First is physically, then comes emotionally. I did not process my emotions in the beginning. I was just like, okay, I used to be an athlete. I got this. I'm gonna do it. And I knew exactly what I was facing. And the emotional part was actually very uncomfortable and very hard for me to process.
I think a lot of us women, especially those of us who've given birth to children, are kind of okay with pain. Like, we get it. But emotionally, how do you prepare for that?
It was hard. And at that time, I really put myself last still.
Yeah.
I wasn't even thinking about myself. I left a safe space for my husband and my children to tell me what they were thinking.
That's incredible that you invited their concerns into your space when you had to have been personally reeling to take that on. How did it feel to hear that and to hear their fears when you obviously had to have had your own?
I didn't process my fears just yet, right? I was trying to take it day by day. I was a little bit on the numb side with it all. I poured myself back into my work. I was like, I'm gonna help other people and I'm going to just focus.
You and I do have very eerily similar stories. I didn't miss one day of work other than the surgery for the double mastectomy, and maybe I shouldn't have. I look back and think, why didn't I give myself a break? Because I think in a weird way, I'm hearing you taking on other people's pain, other people's concern, because that way you didn't have to deal with your own. For some of those folks who are struggling, who are feeling overwhelmed and maybe even emotionally unsupported, what would you tell them?
For people who are suffering right now, I think that they should consider grieving and go ahead and say all those curse words and live in that moment a little bit. But then you have to start processing those emotions. For me, my lesson was, let's be at peace internally and let your light that was dim inside shine out.
Is there anything that surprised you that you have more of now that you got from going through what you went through?
I got more of respecting myself in the sense that I learned when to say no. So, and unapologetically. And it was just really helpful for me because I always did things for other people and I was drowning. But I could put it on a very happy smile and keep going. But now I reserve that energy to my husband and to my children and to myself now. I give it to myself.
Lena, I've just loved getting to know you. I'm confident that what you've shared today will have an impact on so many. This conversation is as real as it gets, and that's what Voices of More is all about. Real stories that remind us we can be more, share more, and inspire more without compromising who we are and what we stand for. Thank you for being vulnerable and honest with us today. And to hear more voices of strength and fortitude, visit voicesofmore.com. And please see important safety information at the end of this video.
What is KISQALI? KISQALI ribociclib is a prescription medicine used to treat adults with hormone receptor HR-positive human epidermal growth factor receptor 2 HER2-negative breast cancer in combination with an aromatase inhibitor for stage 2 and 3 early breast cancer with a high risk of coming back. It has gotten worse or has spread to other parts of the body, advanced or metastatic breast cancer, in combination with an aromatase inhibitor as the first endocrine-based therapy, or fulvestrant as the first endocrine-based therapy, or following disease progression on endocrine therapy. It is not known if KISQALI is safe and effective in children. Important safety information. KISQALI may cause serious side effects, including lung problems. KISQALI may cause severe or life-threatening inflammation of the lungs during treatment that may lead to death. Tell your healthcare provider right away if you have any new or worsening symptoms, including trouble breathing or shortness of breath, cough with or without mucus, chest pain. Severe skin reactions. Tell your healthcare provider or get medical help right away if you get severe rash or rash that keeps getting worse, reddened skin, flu-like symptoms, skin pain or burning, blistering of the lips, eyes, or mouth, blisters on the skin or skin peeling, with or without fever. Heart rhythm problems, QT prolongation. KISQALI can cause a heart problem known as QT prolongation. This condition can cause an abnormal heartbeat and may lead to death. Your healthcare provider should check your heart and do blood tests before and during treatment with KISQALI. Tell your healthcare provider right away if you have a change in your heartbeat, a fast or irregular heartbeat, or if you feel dizzy or faint. Liver problems. KISQALI can cause serious liver problems. Your healthcare provider should do blood tests to check your liver before and during treatment with KISQALI. Tell your healthcare provider right away if you get any of the following signs and symptoms of liver problems: yellowing of your skin or the whites of your eyes, jaundice; dark or brown, tea-colored urine; feeling very tired; loss of appetite; pain on the upper right side of your stomach area, abdomen; bleeding or bruising more easily than normal; low white blood cell counts, neutropenia. Low white blood cell counts are very common during treatment with KISQALI and may result in infections that may be severe. Your healthcare provider should check your white blood cell counts before and during treatment with KISQALI. Tell your healthcare provider right away if you have signs and symptoms of low white blood cell counts or infections, such as fever and chills. Your healthcare provider may tell you to decrease your dose, temporarily stop, or completely stop taking KISQALI if you develop certain serious side effects during treatment with KISQALI. What should I tell my healthcare provider before taking KISQALI? Before you take KISQALI, tell your healthcare provider if you have any heart problems, including heart failure, irregular heartbeats, and QT prolongation, have ever had a heart attack, have a slow heartbeat, bradycardia, have high blood pressure that is not controlled, have decreased thyroid gland function, hypothyroidism, have problems with the amount of potassium, calcium, phosphorus, or magnesium in your blood, have fever, chills, or any other signs or symptoms of infection, have liver problems, have kidney problems, are pregnant or plan to become pregnant. KISQALI can harm your unborn baby. If you are able to become pregnant, your healthcare provider should do a pregnancy test before you start treatment with KISQALI. Females who are able to become pregnant and who take KISQALI should use effective birth control during treatment and for at least 3 weeks after the last dose of KISQALI. Talk to your healthcare provider about birth control methods that may be right for you during this time. If you become pregnant or think you are pregnant, tell your healthcare provider right away. Are breastfeeding or plan to breastfeed. It is not known if KISQALI passes into your breast milk. Do not breastfeed during treatment with KISQALI and for at least 3 weeks after the last dose of KISQALI. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. KISQALI and other medicines may affect each other, causing side effects. Know the medicines you take. Keep a list of them to show your healthcare provider or pharmacist when you get a new medicine. What should I avoid while taking KISQALI? Avoid eating grapefruit and avoid drinking grapefruit juice during treatment with KISQALI, since these may increase the amount of KISQALI in your blood. The most common side effects of KISQALI in people with early breast cancer include decreased white blood cell counts, decreased red blood cell counts, increased liver function tests, infections, increased kidney function test, decreased platelet counts, nausea, headache, tiredness. The most common side effects of KISQALI in people with advanced or metastatic breast cancer include decreased white blood cell counts, decreased red blood cell counts, increased liver function tests, infections, nausea, increased kidney function test, tiredness, decreased platelet counts, diarrhea, vomiting, headache, constipation, hair loss, cough, rash, back pain, low blood sugar level. KISQALI may cause fertility problems in males, which may affect your ability to father a child. Talk to your healthcare provider if this is a concern for you. Tell your healthcare provider if you have any side effect that bothers you or that does not go away. These are not all the possible side effects of KISQALI. For more information, ask your healthcare provider or pharmacist. Call your doctor for medical advice about side effects. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. Please see full prescribing information, including patient information, at KISQALI.com.